Disseminated intravascular coagulopathy is a secondary, life-threatening condition in animals in which the normal balance of clotting and bleeding is lost. It always occurs due to an underlying problem such as septicemia, toxemia, hyperthermia, severe infections, tissue damage, canine heartworm disease, gastric dilatation, acidosis, viral diseases like canine hepatitis, feline infectious peritonitis, feline panleukopenia, or cancers such as leukemia and lymphosarcoma. The key concept is that both excessive clot formation and excessive clot breakdown occur at the same time. Two main processes explain this condition. Thrombin causes clot formation, while plasmin breaks down clots. If thrombin activity dominates, clots form in blood vessels and block circulation. If plasmin dominates, clots break down excessively, leading to bleeding. In most cases, both processes occur together. Tissue damage and inflammation release substances that activate platelets and clotting pathways, leads to clot formation. Platelets and damaged red blood cells release factors that further increase clotting. At the same time, toxins, immune complexes, and complement activation increase thrombin formation. Meanwhile, plasmin breaks fibrin into fibrin degradation products, which prevent normal clotting and increase bleeding. This creates a dangerous cycle of thrombosis and hemorrhage. Diagnosis is based on laboratory tests. Buccal mucosal bleeding time in dogs normally ranges from 1.5 to 4.5 minutes, an increase suggests platelet dysfunction. Other important tests include prothrombin time, thrombin time, clotting factor assays, and fibrinogen levels to assess clotting versus bleeding status. Treatment focuses first on correcting the underlying cause, such as antibiotics for infection, antitoxins in toxemia, control of fever, or removal of necrotic tissue. Supportive therapy is essential. In bleeding cases, whole blood transfusion is preferred. Fluid therapy with normal saline or Ringer's solution is used to maintain circulation. If anticoagulant poisoning such as rodenticide toxicity is involved, vitamin K1 is given. If excessive clotting is the main problem, heparin may be used carefully. In summary, disseminated intravascular coagulopathy is a complex condition involving simultaneous clotting and bleeding. Early diagnosis, treatment of the underlying cause, and careful supportive therapy are essential to prevent fatal outcomes. If you found this helpful, don't forget to like, subscribe, and stay tuned for more vet care updates.